The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
All right, so good evening. It is 6:04 p.m. and I'd like to call the December 14th, 2020 meeting of the Board of Health to order. And we welcome our guests who are with us this evening. We have some people on our call with us.
So I would like to also, Stephanie, not to interrupt, but just welcome Sarah McColgan. She is the tobacco control MHOA person. She's going to be giving us a presentation, but first I know we have to get through open forum. So Sarah, bear with us a hair, and you're still one of the first things on the agenda.
Okay, so then with that, I guess we will move to open forum.
So I had wanted to bring something up during open forum, Stephanie, and that was about the fact that Westford, the community of Westford itself is in the red, but I need to stress very much that the transmission within the school systems is negligible, okay? And I know that people are very concerned about the numbers in Westford, but Joanne, you and I had a discussion earlier. What had you mentioned about the whole being in the red?
So, I know that Jeff, can speak to it as well. But, early on course, the city I work for has been in the red for a long time. It is the common practice to go through 3 weeks of reporting, so you have 4 weeks of data to kind of see what's happening within the community before. This was, the recommendation before you make any judgments. I mean, obviously, it can be left up to the call if there's something horrendous happening quickly and you can see that. But otherwise, it was really meant to have a few weeks of data to look at, so that you're not jumping back and forth and back and forth. In other words. And 3 weeks of reporting equals 4 weeks of data, because it's 2-week increments, so that you'd have, at least a good chunk of data to look at to make some decisions from, but again, having said that, that's the recommendation. I think most communities are using that, so I know this is the first week that we've been in the red. I don't know, kind of what the feel is and of the community and what's happening. So, I'm glad to have you, Sue, here to explain what's going on. So.
Yeah, so I just wanted to talk a little bit about in the school, and then Gail, maybe you could talk about the contact tracing. So myself and all the other school nurses have been a little overwhelmed recently, and we're overwhelmed because there has been an increase in the community, which obviously affects the schools. It affects staffing, and it affects some of the student. And I think the biggest issue will always be if we can have enough staffing. And as long as we can have enough staffing, there really is no reason that we should be going remote at this point in time, because there is no transmission going on in the schools. We all know that since Thanksgiving, and we knew this would happen, there's been a huge uptick. And from my experience, and Gail, I think you're in the same boat because I've been helping with it. The cases we're seeing are, we're seeing a lot more teenagers. I hate to say, but we are. And we're seeing of the younger children, it's typically that the parents bring it home. But there has truly been no transmission within the school buildings. And I will say, as I've said from the get-go, that the schools are one of the safest places to be. The Westford school system has worked very hard to make sure that the schools are clean, that we're keeping the distancing. I work at Stony Brook Middle School. My custodians are in and out of my office, wiping my doorknobs several times a day. I feel very comfortable saying that we are working in a very safe environment. All of us are in all of the schools. We have no control over what's going on in the community. And Jeff, I was very grateful to see that December 11th note that you went out to all the residents, and some of the guidance is very important about eliminating, keeping our social gatherings down, which that has been problematic. We have definitely seen a rise in household cases where there's whole households now having it, and then friends of household members. So I would say that's one of the biggest issues I've seen. What would you say, Gail, about that?
So I will thank you for that, Sue, because everything you're saying as a contact tracer and as a case investigator that I've been doing since March, the uptick has really risen. And really after Thanksgiving with all the gatherings, I will say we have had quite an uptick. The cases are mostly household, as you had just said. Some are sports, where the sports, where, before the, pre-game, post-game, and, during the game, there may be some exposures there, but it's definitely the gatherings that we've seen very much so, that people are just COVID fatigued. Yeah. I mean, people are tired, and they're tired of the rules, and they're tired of all of this. And we all agree. I don't think anyone here doesn't agree with that. We're all tired, but it's important that we just keep up with the social distancing and the mask wearing and the hand washing, and really be cognizant, because it is the dark days of winter and we have to keep going. The vaccine is almost here, and we're just hoping that we can just really just hold on and limit the gatherings, because right now with the holidays coming up, I fear that we're going to see what we just saw at Thanksgiving, where the uptick is just going to be astronomical again. And it's really more than the four of us can really handle. I mean, Sue, Kathy Bordeaux, and Jennifer Ross have all been helping me. Thank God. And then we're getting also the MRC volunteers we're waiting for them to come on board, but to help, because it's too much for one person. So without the help of, the Sues and the Kathys and the Jennifers, I wouldn't be able to do this job.
Thank
And
you.
I will say that the school system itself, people should know that the nurses are working closely with administration, working closely with the health department, and we're all filling in a spreadsheet that Carrie Cleary and Bill Olson have access to as well, sharing information about the positive cases. We don't share names, but whether we have a student who's positive, a staff member positive, or who's in quarantine. And again, unfortunately, this week, several of us we have several staff members in quarantine because of different situations. And I know that people have been very anxious because of that. But I think if everybody can listen carefully when we talk about what it means. I know for myself and some of the other nurses, sometimes we'll talk to staff or parents and say that child would not be considered a close contact, or as a staff member, you're not considered a close contact, and people are still nervous and they want to go get tested. And I appreciate that. I really do. But I promise you that we're sharing the most up-to-date information we have. And if people really want to get tested, they certainly can. But I would rather us use tests for those who have been told they need to get tested, or for those who are symptomatic. I think any of us who have tried to access lines or getting tested, it's terrible out there right now. And so, again, I personally feel like we should do our best to keep our students in school. And I don't think, Jeff, I could be mistaken, but as a health department, Board of Health, that's not really our call anyway. It's just to support and give any recommendations.
100%, yes. Speaking of any information, we do have Bill Olson, who's willing to give an update as an attendee. Bill, if you want to unmute yourself, I think you have to unmute before I can unmute you.
Oh, I'm all set, Jeff.
You should be free.
All right. Well, good evening, everyone. Thank you for allowing me to just provide you with an update. And first, I have to say, we could not ask for a better group of school nurses nor health department workers in Gail and Jeff. They have been with us day in, day out, week in, week out. So to our nurses and health department staff, thank you very much. We currently have 27 students throughout the school system who have tested positive. That is 0.57% of our student population. We have 10 staff members who have tested positive. That's 2.1% of our staffing. In terms of close contacts, we have 123 students who have been considered close contacts. That's 2.6% of our students. And we have 19 staff members who have been considered close contacts. That's 4% of our staff. I think the inclination of many people in terms of hearing headlines, seeing what's happening all around us in terms of the escalation of cases, immediately default to, well, we need to go remote. But the data, and I want to be focused on the data doesn't necessarily indicate. It does indicate we need to continue. Let's see what I've got here. We need to continue with the cleaning and disinfecting, certainly. But the incidence of cases is focused at Westford Academy, but there's 13 positive students out of 1,650 students. The close contacts are clustered at Westford Academy. There are 46 at Westford Academy. There are 19 close contacts at the day, and there are 25 close contacts at the Nabnasset. about 16 of those 25 are 2 preschool classes that we decided out of caution, we would consider close contacts and would quarantine. So the numbers for our school system, quite honestly, are still relatively low. Look, we don't want any cases, obviously, but as Sue has indicated, the transmission rate in our school system is virtually negligible. It's all happening coming in from the outside. And so I'll be glad to answer any questions, but I think for right now, certainly my recommendation would be to hold the course and keep going with a hybrid model as long as we can, and stay in conference with you, Jeff, and Gail and Sue and the rest of our nurses in case there's any need for any change in our decision.
That sounds reasonable to me, Bill.
Thank you.
All right, if anybody does have any questions at the top of the attendees list, you'll have a hand that you can raise up. If anybody does, we can address those.
Jeff and Stephanie, I just have a question. Given
Sure.
the overwhelming burden on the health department staff for contact tracing, do we have a case to go to the Board of Selectmen and request some kind of emergency funding for additional staffing temporarily?
So currently we do have some funding for, the short answer is yes, I certainly think we do. But we are going to be running out of the current funding we have on December 30th. So any CARES Act funding and any funding we've received through the MAPC or the state will either, what we haven't used, and I'm pretty sure we're going to use up every penny, what we haven't used will revert back to the state or be cut off at that point. So on January 1st, we are going to maybe not have the same ability to contact trace within our own community unless we revert to the CTC. And currently to date, with Gail and Sue and Jennifer Ross and Kathy Bordeaux and now our MRC volunteers, we've been able to handle all of our contact tracing to a very close person-to-person type of tracing, which I think has helped keep our numbers low, where we've been able to reach our residents directly. I would like to be able to continue to deliver that really high level of service. I don't know if we'll be able to do it exactly the same on the 1st, but I certainly think it would be worthwhile to look for funding to make sure we can pay staff and people the either overtime or funding to keep going. So short answer, yes, I think it would be worthwhile.
Jeff, has there been any, I haven't heard anything, but has there been any discussion of renewing the extra funding? Have you heard anything?
So today I was on the call that all communities, when you go to the red category, have to sit on. And there was discussion at that call that there would be additional funding coming, as they put it, very early in 21. Whether that means that first week or we're waiting till several weeks further, I don't know what that means yet. But I do believe there will be some funding. I just don't know what form it's going to come in yet and what we'll receive and how it will be earmarked for use. I know Ray and Gail have been working with the Coalition for Local Public Health, which is working on some of that funding themselves. And hopefully we'll have some answers on when we can use that soon.
Okay, so it sounds like maybe we should also discuss with the select board some emergency funding to help bridge at the very least from the 1st forward.
Yes, as it stands right now, the money that's being used to pay one part-time nurse right now and any overtime will dry up on the 30th, and anything those people do after that will technically be on their own time, which I don't think is fair or reasonable. Not with the amount of work that's actually being done by them.
So we should perhaps look into that as a board.
I have a question
Right.
that's come in, and I will read it. When you contact trace those teams at WA, do you ask who they hang out with? How do you know they are giving you thorough and accurate answers?
We
Does
don't.
anybody want to take that?
I'll be happy to tell you a little bit about case investigations. When I have a positive case that comes into the database that I share with the state of Massachusetts, that is how I know when to start doing my case investigations, is when a case pops into my database. I will then call that person, and then I do all of my case investigations with that individual. In the conversation, I will then ask, who are their close contacts? And so that is always the household people, the people that are living in the home. They're always the contact. And then I will say, is there anybody else? Grandmothers, grandfathers, aunts, uncles, cousins, relatives. That's exactly what I say. Are there any friends? And I try to go back 48 hours prior to the onset of symptoms, because that's your infectious period, is 48 hours prior to the symptoms that begin. And I ask them. It is up to that person to tell me who their close contacts are. I don't know anybody I'm talking to on the phone when I just randomly pick up the phone and call you. So it is up to the person to identify, and I explain what the definition is, which is a close contact that is someone closer than 6 feet and longer than 15 minutes in a 24-hour period. And I go over this with every single person that I speak with. It is up to that person to tell me whom they identify as a close contact. If they do not give me names, then I don't know. And I don't have any other follow up on that. It's really based on that individual telling the public health nurse who should be in quarantine.
And I'll add to Gail. Can I add to Gail's as well? So we definitely have found along the way that people are very hesitant to share information with us. I think they think we're going to get somebody in trouble, and it's never been about that. It's genuinely to try to stop the spread and educate. And so it is a very frustrating situation when we do ask and people don't want to share it with us. So the one thing that we try really hard to do is say, if you won't give us names, we will at least give you information to share. But the irony is, there's many times they end up showing up in our database too, because then they ultimately test positive. Within the school system, the way it works is if there's an actual exposure in the building, so I'm aware of a child being in the building and I find out that they were symptomatic at school, I do have to ask all of the child's teachers. So, in an elementary setting, it's a little different. Middle school, they have several teachers. The high school, they have several teachers. And a case that happens that is symptomatic at school, we will absolutely ask the teachers if they were with that child for more than 15 minutes, less than 6 feet apart, because we care very much about our students, but we also care about our staff, and we want to make sure that they are able to answer us honestly if a student is positive while they've been in the school. If they've been positive when they were outside of school, we don't have to tell the teachers or ask the teachers about close contacts, because nobody was a close contact in the building. So that's the process, and it is tricky. Jeff, can I ask you one question? Maybe share what it means to be in the red in Westford?
So
Later, or for people on it right now, they might not.
So what it means to be in the red is a certain percentage of the population becomes positive through the testing. And what we get in the percent positivity data each week is the amount of tests that were administered in town and the amount of people that were positive in town. And that percentage what determines your percent positivity and how many people in town compared to your population will make that number. We do have another question too. We actually have two more questions, and I want to try to get through all of them. And first one is, how are you determining that transmission is not happening in schools?
How are we determining that?
Yes.
Because we know who's had the virus. So the students that, the situations where we've had positive cases, it has not occurred in our school buildings. So when we're doing the contact tracing, we're able to ask, and like I said, most of our young students, It's been from their parents. It's brought in from the outside. And in terms of our high school students, again, in doing contact tracing, it is the transmission is not happening in the building because what we know it because we're talking to them about where they've been, and it's generally, like I said, to date, just for me personally, to date, and actually with all the nurses, we are not aware of any situation where there's been some transmission. No, I take it back. There was at the high school. A student came to school who, and there was a transmission done at the high school. But I can tell you right now, at my school at Stony Brook, there has been not one transmission in the building. And the reason I know that is because I know the students who have had COVID.
All right, so
Yeah.
next question I have. So when we get the school letters, these people are already in Gail's database and tested positive? Question mark. I think I can answer that.
Yep.
So many people that get tested will know before it actually lands into the Maven database. And I think the vast majority of people that test positive are doing the right thing and letting people know. That may generate the school letter faster than it actually shows up in Maven. And then when it finally does show up in Maven, we will address it accordingly in our notes. So I think it varies day to day on when people are tested and when people get their results and when it shows up in the Maven reporting system. It's different every time.
Additionally, Jeff, if the person is, for example, faculty who doesn't, or staff who doesn't live in town, they would not show up in Gail's database, but they would show up in the database in the town in which they reside. But they're doing the right thing and letting people know.
I've got another question to keep us moving. When you contact trace students, are you speaking with the parents, even if it's a WA student?
Yes, anyone under the age of 18, I have to speak with the parent. Now, the parent could be in the room and on speakerphone while I'm talking to the student asking clinical questions. That would be okay, but I do not speak to children without a parent around. The parent has to be on the phone with me.
And most of the phone numbers that come in attached to the child or the teenager is the parent's number anyway. So when we make the phone call, it's traditionally to the parent.
That's the last question I see, but while we have this particular group of people that are interested, because we have 87 people, which is probably our largest meeting group in quite some time. There's been a lot of, I'd just like to bring this up in open forum if I can. There's been a lot of question on when vaccine will actually be available. And the short answer is we're not sure yet locally. Your local health department isn't necessarily going to have this vaccine. If there is information to be given on when teachers, public health personnel, first responders can be vaccinated, we will certainly share that. But currently that information hasn't been given out to us quite yet. We do have one more question.
Okay.
Why did town manager Ross close the town offices to protect her employees? Quoted at the patch, "Are schools safer than town hall?"
I would think it's for an overabundance of caution. When the public comes in, I think it's just really just to protect staff and the town employees.
Well, I think that particular question, if they would like to take that offline, that might be something for the town manager to address that. And we do have another.
Jeff, I would also say that like in our school buildings, nobody's allowed in, like parents aren't allowed in the building. So the children are coming in, in my middle school, they go into their room, they basically are staying in the same room and teachers are rotating through. So it's very different in a town hall, like you say, where people are coming in and out. People are not going in and out of our school buildings. Parents are not allowed in the building. only the students and the staff are.
All right, we have another question, and this, if transmission doesn't happen in school, why are they closing 2 preschool classrooms?
Can I answer
Jeff.
that? Or maybe
Go
Bill, you
ahead.
should answer that. That was absolutely over an abundance of caution, which I'm starting to despise that phrase. But I really think, especially with the younger ones, and I always hesitate when we close entire classrooms, because I think that does create hysteria sometimes. And I totally supported the decision to close those. But it's you will find those children, they're in quarantine. That doesn't mean they're going to get the virus. And one of the things that we forget sometimes, we put people in quarantine, it doesn't mean they are going to end up getting COVID, okay? So again, when we talk about transmission in the schools, none of our close contacts have tested positive that we've identified. So that's how we know there's no transmission going on. So I think, again, they closed the classroom for that reason. There are districts that are closing entire classrooms every time there's a student that has it, and that's just not good practice. And again, this was in consultation. I know, Bill, I was involved in the conversation, and Susan Dubois, and it was truly done just on to make sure there was nobody at risk at all.
Yeah, and may I make a comment, Jeff, just briefly, that you know, what Sue said is very true in terms of the only occupants in our school buildings are our students and our staff. So very similar to town hall. Staff are our employees, and we have to have the students in order to be able to educate, unless they're, you know, doing remote. And so there is no inconsistency there. Now, with respect to those 2 preschool classrooms, preschool children tend to be more mobile. Teachers tend to have to pay a little bit closer attention, certainly, to them, and sometimes up at a little closer distance. So that's why we wanted to be extra safe. It's not like a middle school or a high school or upper elementary where, you know, the students know that there is 6 feet of distancing to be maintained at all times. Preschool students are doing an excellent job, but sometimes there's that need for just a little bit closer contact between the staff member and the student.
Thank you. Jeff, there's one more question.
Looks like actually
A couple
2.
more. Yeah.
I will just read the comment. Thank you so far. Still confused. The letters that say if we haven't been notified, then we aren't close contacts, but Gail isn't doing the tracing, then is it the nurses that are the point, then Gail later on? I think this question would probably be best answered. Do you want to take a stab at it, Gail? Because there's a lot going on in that question.
I think you need to repeat that for me, please.
All right, I'm going to read it exactly how it's worded to me. Thank you so far. Still confused about the school letters that say if we haven't been notified, then we aren't close contacts. But if Gail isn't doing the tracing, then is it the nurses that are the point? Then Gail later on, question mark.
So.
Well,
Okay.
we're working together on this. So
Right. So
know.
I work hand in hand with the school nurses, and thank goodness for them. And we all work collaboratively. It's wonderful. So contact tracing, once again, is from the person who's the actual COVID case. That person identifies their close contacts, and then I do all of the contact tracing of that person. So if a high school student is positive and they say that, and they name another high school kid as their close contact, then I would contact that person who's a close contact. And, you know, we let the school nurses know so that everyone is on the same page, so that we make sure there's no, you know, spread and whatnot.
I think it's key that, I mean, the letters come out, and as quickly as possible, anybody who, when it's initially discovered, as quickly as possible, their contacts are notified.
I also want to say one more thing about the by the time I know something gets it, when something gets into when a case gets into my database. So what happens if you get a COVID test, the lab might call you much quicker and report to you that you are negative or positive. But by the time the lab sends their bulk of results to the state lab, and by the time the state puts it into our database, there is a delay. So sometimes people are wondering why the health department hasn't notified them that they are a close contact yet. And why do I know? And how come the health department hasn't called me? There are times where cases don't even come into the database for whatever reason, and some come in many days later. So it's not that we're not addressing it. I'm telling you, when it comes into my database, we're all over it, and we start that right away. So
And let me add, Gail, though, with school age, what happens is that the parents are letting the school nurse know. So
Yep.
often one of us will find out because they're one of my students, for example. And so I sometimes will then contact Gail and say, heads up, so-and-so is going to be coming into the database. I've already let the nurse at this school know. So that's how we're collaborating. But can I just address those letters, which I have to tell you are very difficult to send out because I know they cause so much angst when I send them out. When we send those letters out, whenever there's a positive case, whether the child has been remote or hybrid, we have to send a letter. We're not allowed to say whether they're in 6th grade, 7th grade, or 8th grade, whether they're pod A or pod B, whether they're in the building or whether they're not, because we have to protect privacy. So that letter is very honestly saying, if you have not been contacted, you honestly don't have anything to worry about. And I promise you that we are working together on this. Like Gail's saying, sometimes things come in late to the database, but we're getting a phone call the minute a parent finds out their child's positive. Imagine the feelings that happen, okay, or a staff member. So I remember when those letters go out, and trust me, I've had to send several myself this year, working with Chris Chu. Every principal and school nurse works with their within their school to do the letter together. But again, those letters are honestly saying, if you didn't individually hear from us, your child has nothing to worry about. And I know people, I think it can be, people are confused by it and they're nervous when they get the letters. And I have a lot of parents that will call me after a letter comes out saying, well, was my child at risk? Or, and I'm again, we have to protect privacy. And so we have to protect the person's privacy while making sure staff and students are safe.
Thanks, Sue. Jeff, there was the question that the data is showing that transmissions aren't happening in the school. Does the Board of Health support having more in-school time for our children? And I think we would say to that we're supporting the school superintendent and working with them in those decisions.
100%.
And then there was the one, have all close contacts gotten tested? So that's about what it means to quarantine when you're a close contact, which does not necessarily mean tested, but
we do recommend it though.
Right.
We absolutely recommend that all close contacts get tested. And if they choose not to get tested, they're out of school longer.
Thank you, Sue.
All right, so I think that gets us through the questions. And I want to thank everybody for putting questions in. And Bill, I want to thank you very much for being on with us and being available for questions.
Thank you.
Jeff, thank you to you and Gail and Sue and the entire board for doing everything and anything to help keep our students and our staff safe in the school system. So far, it's worked out quite well.
Thank you.
Bill, I'm going to remove you as a presenter. I don't know if that will kick you off or not, but I think we're looking at your screen as well, so I think I have to do that. And I thank you very much.
Thank you, everyone.
Let's see.
So now we would have approval of minutes.
Should we Poor Sarah's been waiting.
No. Do we have a motion to move that and take
I'll make the motion.
the tobacco, Sarah's presentation out of order? Thanks, Sue. Is there a second? Or,
I'll second that.
okay, Zach got it first. All in favor?
Aye.
Aye.
Motion passes unanimously. Thank you. Okay. So I think then we're going to hear from Sarah McColgan about the tobacco control program.
Yes,
Good evening,
Sarah.
everybody. Good evening, all set, Jeff?
Yeah, tell me what you want up, Sarah. Do you want the regulation up?
I think probably at first, we may pop to one of the other attachments, but at first, I think the regulation would be good. First of all, let me introduce myself. My name's Sarah McColgan, and I'm the Tobacco Control Director for the Massachusetts Health Officers Association, which, as you may or may not know, is the trade association for the Board of Health staff, as opposed to Massachusetts Association of Health Boards, which is the trade association for the Board of Health members. Jeff contacted me with the Westford regulations and asked me to look them over and give some recommendations. And so I appreciate having the opportunity to speak to the board tonight and any members of the community that might be listening. It seems like a few people dropped off at the end of the COVID discussion, but you know, it's always interesting for me to sit and listen to non-tobacco related things. So definitely makes you humble to know that there are bigger things out there that the health department is dealing with. So so your local regulations here in Westford pretty much started in 1993, and you've amended them numerous times since, generally as new issues have cropped up in either in the community or in the state, and you've amended them to be a little bit more restrictive and take care of those issues as needed. And so when Jeff sent them to me and I reviewed them, I would definitely call these regulations a first generation regulation that's been amended many times. And what I'd like to propose is that Westford Board of Health consider separating out their regulations so that they have, rather than one big document, two documents. One would be for the restricting the sale of tobacco products. And then the second document would be for environmental tobacco smoke, prohibiting smoking in workplaces and public places. And most municipalities in the state have done that over the years. They've separated their regulations out. The two draft regulations that Jeff has sent you are regulations that the technical assistance providers in tobacco control promote across the state to all boards of health. Some boards of health adopt the regulation either, you know, as it is for you, or parts of it are removed, things that they believe don't fit in that community or whatever. And some boards stay with their existing regulations. But I think that there are some good reasons to kind of separate it out. The separate regulations make it easier for retailers to understand what they're looking at. Your current regulations kind of bounce back and forth between tobacco sales and workplace violations and things. So I think probably if we wanted to take up the longer regulation restricting the sale of tobacco products and look at that, what I did was, well, first of all, these regulations have been drafted and revised over the years. The primary authors of the draft are attorneys that provide technical assistance to the state. I'm not an attorney, but these have been, but the draft that you have before you has been reviewed by one of those attorneys, DJ Wilson at Mass Municipal Association. And so they, like you amending your regulation, this sample draft gets amended as needed. And so even though this was sent to Jeff very recently, I believe probably right after the Thanksgiving holiday, there's a new one, and there are new changes since then. And so what you see right now in front of you is not our latest, but our latest has some very subtle little corrections that we've made, things like that. So I can go over those with you. We're constantly revising regulations, sometimes recommending that boards make changes, sometimes recommending, no, the next time you really need to do something serious, we can make this change. You're in a position right now where your current regulations are not in step with the new state law, which the governor signed last year and took effect in June. That state law, among other things, the primary highlights are that it prohibited the sale of all flavored tobacco products, including mint, menthol, and wintergreen, to retail stores, and they can only be sold in adult-only smoking bars, which your current regulations have banned. So you don't have any smoking bars in Westford. Even if you did, those smoking bars would be closed during COVID. That's something that the governor wouldn't consider opening until we're in phase 4, I believe. All flavored products are restricted. It also made sure that all municipalities go up to the age of 21 as far as sale of tobacco products, regulated the nicotine content in electronic nicotine devices, vapes, vape pens, things like that, Juul, and regulated who can sell vape products that contain 35 milligrams per milliliter of nicotine or above, and who has to sell below 35 milligrams of nicotine or below. So those are the probably the highlights of the regulation. There are numerous other things that go in. As far as retailers are concerned, the state changed the fining structure. And the fining structure is dictated by the state. So if there was a sale of tobacco products to a minor in Westford today, say there was a compliance check today and there was a sale today, the town would have no choice but to follow the state regulations and fine that store at least $1,000 if it was their first sale. So the state fining structure is $1,000 for the first sale, $2,000 for the second sale within 36 months of the first, and $5,000 for the third sale within 36 months of the first, along with permit suspensions on the second and third sales. That's not something that Westford can alter. It's prescribed by the state. So your current regulations obviously don't have fines that high. That's only for, those state fines are only for certain types of violations. Your municipal fines that you have in place right now still hold for violations of policies that you have in your municipal regulations that are not addressed in the state law. For example, you've regulated cigar sales so that the sale of a single cigar has to be at least $2.50 or more. Now, if one of your Board of Health staff did an inspection and saw cigars being sold for 50 cents, then they would fine them based on your current Westford regulations, as opposed to a sale to minors is going to be fined based on the state law. So I think that that's kind of, generally I went over some of probably the highlights of the changes. I know that Jeff had asked me to address in the permit or the permit capping area, that the board would possibly want to have or maintain a sunset rule. And the language is already in there. It's I guess it's probably not real spelled out very explicitly, but we can add in some language. And Jeff, if you want to pull that section up, I can reference you what section it is. Section E, section 9B. On page 7. Yeah, there we go. 9B. So there we go. So what you could say is, as of July 1st, 2020, any permit not renewed, either because a retailer no longer sells tobacco products as defined herein, or because a retailer closes the retail business, shall be returned to the Westford Board of Health and shall be permanently retired within 30 days by the Westford Board of Health. And the total allowable number of tobacco product sales permits under paragraph A shall be reduced by the number of the retired permits. So not only have you capped the number, you're also continuing to reduce the number, and you would reduce it if the permit wasn't captured by a new owner of an establishment within 30 days. So if somebody sold their convenience store to someone and the new owner didn't apply for that permit within 30 days, that permit would be turned back to the town, and your capping number, which I believe might be 20, I don't remember what it is at this point, would be decreased by 1.
Thank you. Jeff, so what Sarah was just saying, that's not quite what we have written. Is that correct? Or
This entire regulation is actually completely revamped and rewritten compared to what we have. It's incorporating, no, so this piece, no, it is not actually inclusive of what we currently have. We were working on language that was, I think, a little more wordy than this. This is simplifies what we were trying to do, yet does the exact same thing.
okay, but B there didn't read the way I thought it was just read to us.
The 30 days isn't in there.
Right. The 30 days isn't in there, so you can add the 30 days in, but DJ Wilson has advised me that you don't have to. You would that the language that's there still captures it, but if you wanted to, be more explicit about it, you could add the 30 days in.
Okay.
And I would definitely recommend that any draft that you accept at some point, this may have changes that you want to incorporate and everything. Any draft that you accept, that you pass on to town council for their review.
Yeah, I think when, one of these meetings when we were hashing out the language, that did come up about, giving them a period of time that they, whatever the new owner could apply. And I think we did say 30 days. Is that correct? Just to, because there's a lot, transferring businesses over. Sometimes they forget. Not that I'm giving anybody extra time, but it was, I thought it was in there already.
So I
mean,
think what we're hearing though is that the way it's written with A, I don't know, this is what I'm trying to understand. Ms. Sarah, could you
Oh,
read
okay, because
again
it's in
what
A already?
Yeah, because it's in A, is that, I think is what they're saying, we don't necessarily need it.
Right.
Could you read what you had for B? Is it, because I didn't think it read exactly as this.
I thought A had to do with an existing permit holder has to renew their permit. And if they don't, then there's a problem. B was if there was a transfer, so
Yeah,
I have a convenience
my
store in
apologies. Joanne's
December,
right.
I have to renew my license. If I don't renew it by December 31st, I've got a month and then it goes away. As
Right.
opposed to, I have a business owner, I'm selling it to you. You have 30 days to take over my permit, and if you don't, it disappears.
Right, right. And so if you want that spelled out, in the third line of B, where it says, Westford Board of Health and shall be permanently retired within 30 days by the Board of Health. So you would just add in the words, well, I would just add in the words within 30 days. And that would spell that out.
Yeah, I just have to think of where to stick it. When you said it, it sounded, I don't know, however you read it, Sarah, sounded good. Within
It
30
sounded,
days?
and that's how I read it, because I'm reading it right off my copy here. So let me
Yeah,
start it at the beginning.
Westford Board of
As,
Health within 30 days and shall be,
Yeah.
yeah,
yep.
or, that's
So
all
when
right.
you look, and if you look just a little further below, the next section, C is in green. I probably should have mentioned at the beginning, anything that's highlighted in yellow pertains to the new state law. Although Jeff, did you just highlight some things?
Yeah, I'm gonna change the
Yeah.
color.
Oh, should have picked another color, Jeff. Anything that was highlighted in yellow when Jeff got this.
Leave it alone.
There we go.
Oh, not
pertains to the
green
new
either.
state law.
Not green. Maybe
Not
blue.
green.
No. Yellow is new state law. Green is
Yeah.
a policy decision that the board needs to make. So, yeah, so there you are. So blue can be, new wording or whatever you want to call it.
All right, well, I'll leave it blue so we know what we're talking about right now.
Right. So I think at this point for the board to, if you haven't already, for the board to review the regulations, look at all of the green policy decisions and see if those are ones that you want to incorporate into the regulation. And if you don't, we can pull them out. And again, the yellow is anything pertaining to the new state law, so that those things need to stay in regardless of what the board wants to do.
So, and like, I'm just looking at 8 right above where we were. And are you saying then that, is that something new that was put in that we should discuss, or was that already?
It's not state law. It's a policy that you can put into your regulations if you'd like.
Okay.
It's not in your current regulations now.
Okay, thank you.
Okay. And then Jeff, I think he provided you with kind of a chart type thing of finding options for the tobacco sales regulations. And when he asked me to do that, to kind of detail out, okay, what fits under the state law and what fits under the Westford regulations, it motivated the 3 TA providers, DJ Wilson and Cheryl Sabara and myself, to put that right into the regulations. So the new regulations that we, the new draft that we came up with last Friday has something similar to what you see on your screen right now, right in the regulation. It spells out what's being covered by the state law and what's being, what would be covered in your community by the local regulations. So that retailers can kind of have a good understanding of where they fit in that and how, you know, how would they end up with a $1,000, $2,000 or $5,000 fine as opposed to how they would get a how would you folks have a flat $300, so as opposed to how would they get a $300 fine?
Well, Sarah, I'm confused then by that. You said there's certain situations. So what are they?
They're listed right up there. So Jeff, if we could scroll up a little bit to number 1. Okay, so the new state law says that if you go down to the second bullet, the fines for are imposed for the following. So sales to minors, sale of flavored products, sale of e-cigarettes with more than the 35 milligrams of nicotine in a convenience type store, redemption of coupons, distribution of free samples, out of package sales, loose cigarettes, breaking open a pack of cigarettes, sale of liquid or gel containing nicotine in packaging that's not child resistant, operating in a location that's not considered permanent and non-mobile, refusal to allow an inspection, and selling products if all previous fines have not been paid. So those things would be fine under the state law.
But, you know, it's almost confusing up there where it says the new state law boards of health are mandated. There are certain situations that require retailers to be defined under the fining structure of. It's almost like you read it and you say, what are they? I almost feel like, do you even need that line? Because you're saying you put that down and then the above mentioned fines are for that. Because it's almost like there are certain situations and you're saying, well, what are they? And then you say it below.
Okay. Well, I mean, I can flip it around if you want. That's not the way it was written in the newest regulation that's coming out. I just did something real quick to get to Jeff so that he could get it out to you folks. It is confusing to have two fining structures though. And so one thing that some municipalities are looking at is to eliminate the two fining structures. You can't eliminate the fining structure on the state law. Some municipalities are considering going with the state law fining structure. So everything would be 1,000 on the first violation, 2,000 on the second violation with a permit suspension, and 5,000 on the third violation with a permit suspension.
Jeff,
Why wouldn't we do that?
well, do we in Westford have any reason that we can't do that? Do we have a cap on our fines at all?
Well, we've got a bylaw on our fines, but there's nothing that says we have to use that. If there's a state law, I would have to go to our legal department, but I believe we could just use this law, which is more stringent.
Right, you can issue fines under non-criminal disposition, but the state specifies that in order for it to be a non-criminal fine, that the cap is $300. So the minute you go to $1,000 fine, it's not issued under non-criminal disposition anymore. It's issued under a health order, correction order, cease and desist. So little different procedure. And then Sue, I believe you had a question?
No, I just asked it.
Oh, okay.
Yeah.
So, you know, some towns believe that it's easier to understand for the retailers, just one set of fines. You know, tobacco regulation is not new in Massachusetts. We've been at this for 30 years, and retailers who own stores know that it's illegal to sell to minors. You know, so I think some communities have decided, you know, just like when you folks put in the flavor restriction, kind of enough is enough, and we need to, you know, step up the game a little bit.
We actually do have a question on this that's come in.
Can I make a comment first, please?
Yes, Joanne, and take the question.
Just for clarity, the local fines were already in place, so that
Yep.
people, if they're listening, before this new state law and their fining structure. So if people are wondering why we have these two, it's because we already had our fining structure in place based on non-criminal dispositions. So, you know, what's kind of before us now is if we want to continue that for those areas that we thought we should use the non-criminal for and fine people, keep those in place. Or like Sarah was saying, just do everything under that fining structure that the state has allowed. It
Well, the
goes, like
state,
you said, it goes from non-criminal, like you said, it's no longer a non-criminal disposition. It goes over 300, which is again why our cap was 300, because that was the way the non-criminal disposition was set up. So
right,
it clarifies it for why we have two. It's just because the new state law came into being.
right, and the state mandates on all of those situations in number 1 that you fine at the higher rate. And that money comes back to the town. It doesn't go to the state. So when you write a, $2,000 or $5,000 health order, or correction order to a retailer, that they pay that to the town.
Okay, Jeff, do you want to read the question?
Sure. So this person is asking this question: what is the rationale for retiring a permit? Why not relicense it? Also, if the store is sold and the buyer didn't apply for the permit on his or her own, would the town take action to remind the buyer?
So we had discussed this a fair amount, which is why our language we struggled so much with the language when we were working on it, if I recall correctly. With
As
the
far
idea.
as why you would retire a permit, it's to decrease the density of tobacco retailers within the town, and eventually, decreasing it through kind of the normal, closing of stores, and whether or not the town would pick up the phone and call the new owner or whatever. That's up to you folks. I think that's a totally reasonable thing to do. If if they're setting up the store or whatever. I mean, obviously they couldn't start selling cigarettes until they had their permit. So before they get to that point, they should be contacting the health department to apply for their permit. They should be coming in with their Department of Revenue permits in hand to show you that they've already obtained those, and applying for the permit that is still kind of attached to that address.
And if I recall, Ray and Jeff had said that, generally when businesses change hands, this is a process that is pretty familiar to the new owners, and they come in prepared,
right,
and really handle that smoothly. Is that correct?
That's 100% correct.
And it makes sense. I mean, if it's a chain, they do it routinely. They've got people in their corporation that this is their job, re-permitting their stores. If it's a mom and pop, they're probably getting advice from, whatever attorney helped them with the sale and everything, and reminding them to do things like that.
Okay, thank
Quick
you.
question,
So-
Stephanie.
Yeah.
I just had a quick question for Sarah. Sarah, page 9, section K, talks about redeeming of coupons and such. I was just curious, some of these stores have online sales. Are they able to offer any kind of sale or a coupon if it's their website, or no?
Online sales to folks in Massachusetts, or?
Yes.
Yeah, they're not. I don't believe that they're allowed to be redeeming the coupons and things on an online sale, but I can check on that, Ray.
Okay, that'd be great.
Yeah, I mean, there aren't a lot of coupon situations out there, so it doesn't happen a lot. But I can
Well, I
definitely.
know like Marlboro, several tobacco companies do still put coupons in for vape pens and things like that
Yeah.
actually in the pack. I was just curious, we do have some stores in town that have online websites. So I was just curious. Thank you.
So both, I guess, to Ray and Sarah, my question on that, when I read this, it made it appear that perhaps a coupon could be used, but it couldn't decrease the price below the Massachusetts minimum.
Right, right. But I just want to make sure as far as the online sale, that there's nothing that prohibits a retailer from redeeming a coupon through an online sale. I don't believe there is, but generally the language makes it so that the coupon redemption, as you said, doesn't decrease it below state minimum, which changes occasionally.
So Sarah, in the draft that you sent us, the board does need to make some decisions on, like we talked about, the green sections,
Right.
on if they want to keep that particular language or change it or add the dates and times.
Keep it in, take it out, whatever you'd like to do. Mhm.
Do we need, Jeff? I mean, we've worked on this a lot, but it looks like there's a lot here that I don't know that we're ready. I don't know. Do we think that we're ready to accept it as it is? Or do we need to have like a working group take a look at this and bring it back next month? What?
So I think a working group, and I don't think this will take extraordinarily a large amount of time. I think this can be done in probably just a few hours or a couple of sittings, just to go page by page and look at this language. Additionally, once the board does that and they're satisfied with all of the language, this should really go to town legal to make sure that the town is satisfied with it in its present form. And once they are, then I think we can take this and put a public hearing out and then adopt it.
Right.
Okay.
And if you'd like me involved in the working group, I'm happy to do that. But otherwise, Jeff and Ray have my contact information. You can email me, call me with questions, whatever works for you folks.
So I'd like to just point out that this is a pretty big change from our current regulation. And Sarah, I think what you said, that there was already more changes from when you and I gave me this, so we may need to update this again already.
There are some very minor little language changes, but nothing really changes the substance of the regulation. Just, lawyers, they're tweaking things all the time. So a lot of little tweaks.
And I guess the other question is whether we as a board want, as Sarah said, it was divided into the two separate regs.
Right.
Is that something we want to do?
Based off of everything I've read, I would say yes, for sure. We would want to do that.
Yeah, I'm in agreement, only because, it was a big document to kind of weed through, and as we all know, we've updated it and changed it and updated it and changed it. It will be much easier for us and for the public, depending on what it is that they're trying to find, to have it in
Right.
those documents, especially if, it's just about retail sales or something, that they don't need all the rest of that. And
So do we need?
I think that's a good idea.
Do we need to do anything then, do we need any sort of vote before just the working group takes it and works on it that way? Or can we just send the working group to work on it that way?
I think we can send the working group to work on. Go ahead, Joanne.
No, I was going to say, that to me would be the vote after the working group, not so much to separate it, but on each document. We can vote to separate it and then vote on the document. But
Working group will get back.
yeah, I'll let them look at it. That's my opinion.
I think you're right, Joanne, 100%. So I think if we have volunteers, which can only be 2 on the board for the working group, and I don't anticipate this taking an extraordinarily large amount of time.
So I'm happy to work on it. Are there others who are interested in doing this?
There's a difference between interested and not.
I'm assuming Sue and Joanne are out.
I really want to do it, but I don't want to commit.
Yeah, no,
I can't follow through on.
Does Michelle or Zach, or either of you interested in working with me on taking a look at it, or do you want me to just do it?
I'll help you.
Somebody
No,
to.
I'm not hearing anything from them. I'll read it. I will,
And,
because I'm barely interested because I'm thinking about
Doing it in.
bringing it to where I currently sit here. Yes.
Okay, then yeah, you do it, Joanne. Yeah.
And Sarah, if you're willing to help out, I'm gonna keep you on that.
Absolutely.
And
Okay.
Yeah, absolutely.
I'll keep
So then I
the
guess
meeting short.
Get, like what we had and then what these changes are, so we can look at them just to make sure we're seeing the similarities. That would be great.
Yeah, and a lot of the difference is just kind of part of it is the splitting them out, the two
Mhm.
different regulations out, and updating a lot of the definitions, because they've been updated over the years since the last time you folks amended your regulation, and just, the lawyers playing with the words. I mean, this was all probably as you were amending, it was exactly what we were recommending that you amend it to at that point. But here we are now, and we've got separate regulations.
Thank you. Yeah, because we were working on this, and I know that we were kind of wanting it to be up to date, but it's hard to know what all of that is.
Well, Sarah,
I'm happy to work with you, and then just I've got the master. I can just put in whatever we want in the new draft, and you can present that to the board whenever.
Great.
Sarah, I can't thank you enough. You've done a tremendous amount of work to help us out. It's fantastic.
Thank you very
No
much.
problem. No problem.
Thank you, Sarah.
Thank you, Sarah.
Oh,
Excellent
you're
work.
welcome. You folks are the heroes. Believe me. I mean, this is easy compared to what health departments are dealing with every day and what school departments are dealing with every day. So
This is important too, though. We will come out on the other side, and we want this to be.
it is. Yeah. And there are some municipalities that are looking at, I think because they've just, got to get a break from COVID, they're looking at, okay, what else can we kind of look at now that isn't going to drive us too crazy. But so I appreciate that. And so Jeff, you want, or Stephanie, do you want to let me know when we can get together, or?
Sure, I'll talk to Joanne and see what works then.
Yeah, okay. And I've got a Zoom account. I can always send out a Zoom to everybody.
All right. Well, I know we're coming up on holidays where people are taking time, but I also, while this is hot, I don't really want to let this sit around and all of a sudden we're looking at March or April and it's not done yet. So I'd like to get this off our plates ASAP. So I'll pick a few dates for everybody and we'll try to work on it between now and our next board meeting, which is January 11th. That may not be a doable date to vote on it simply because of the notification requirements and depending on what we get things back. So we might have to push it out for a public hearing to February, but if we can be
I think
close.
that's probably, yeah, that's probably a better way to go rather than rushing it and, missing deadlines and things.
Would we be able to sort of review it, send it to the attorneys, and then have the vote in February?
Send it to the attorney, and then you've got to put notice in the paper and everything else. So, yeah.
Okay.
Well, whatever dates you land on, I can always cancel my cruise if I need to.
We'll try not to let that happen.
Okay.
Thank you.
All righty. Have a good night,
Thank you,
folks.
Sarah.
Thank you.
All right. Let me pull up the agenda again.
Thank you.
All right, so I think where we're at, Stephanie, is the new guidance issued by the state, just to kind of touch upon it.
Jeff, I think we need to jump back to the minutes.
And it's,
Oh, yeah, we do.
did anybody have comments on them?
I had none.
No comments?
I wasn't there.
I had a few, but they're just sort of clarification type or rewording, but not necessary. So I don't know. Do we want to just accept them and not worry about that? Or that paragraph on the first page where it says Granger inquired if there is another round of testing scheduled. Stevens inquired, then Ken inquired about, I might have said Ken inquired instead of rather what some of the complaints were. Ken inquired about the nature of the complaints and stated those might sway their decision regarding testing.
I would need to go back and re-listen to that to make sure
Okay.
that's the right context.
I just didn't understand really what this said.
But I'm happy to go back and listen to it again
Okay.
and make sure it's right.
So do we then put these
If you
off till
want-
next time or just accept them?
If you want to accept them with clarification on that paragraph, I'm happy to do that. If you want to wait, I can put them out in January.
Okay. Does anybody want to accept them with clarification on that paragraph?
I'll make that motion.
Thanks, Michelle. Is there a second?
Second.
Thanks, Joanne. All in favor?
Aye.
Abstain, I wasn't there.
4 who were attendance and Sue abstaining. Motion passes. Okay. And so then we are on to the new business. Was that correct?
COVID, I believe.
COVID.
Well, that's
So-
new.
Tired of talking about COVID.
Let's talk about COVID.
So I really wanted to just really give an update to the board that the governor did make several changes to some of the guidance, really reducing occupancy from 50 to 40% in a lot of venues. Restaurants now have a 90-minute requirement to have patrons leave after they're done eating, and masks are required the entire time you're in the restaurant unless you are actively eating and drinking right then and there. We are responding to any complaints we have on that. We haven't had any complaints on that, therefore, and it's also only a day old, so it really hasn't had a chance for people to respond to it one way or the other too much. But if we get complaints on those, we are going out. We are going to do like we've done with every other guidance update and make sure people are educated and make sure people are aware of what the new changes are. We're going to make sure in the next couple of days or so that all the private clubs understand what this new guidance means, mainly because private clubs have been a source of transmission in different parts of the state. We want to make sure ours are not. And additionally, with a lot of the guidance, we have been issuing fines to people that have been throwing gatherings or parties. Currently, we have $1,200 in fines out in town that we are waiting for people to either put in writing that they don't want to pay and they would like a hearing, or if they don't respond to us in 21 days, we'll need to file actions in court.
Jeff, can you explain how that is working? How do we know when somebody is violating the gathering order, and how then does this happen?
So the only way we would actually know this is we are taking complaints mainly through police reports. I need something credible that I can use in court and we can follow up on. I know we've received complaints about other gatherings, but we haven't had any actual proof that if I had to walk into a court of law, I wouldn't be able to prove it. 2 events in town have given us absolute proof, including pictures that parties had happened with people not wearing masks and there being more than 10 people, and one even being a party that occurred after 9:30 and people weren't home at the 10 o'clock mark, where the police had to go and intervene. Those we've actually issued some fines on because they've been areas where there's been a little bit of resistance to comply.
I would imagine you could probably find some evidence on social media as well.
That's usually where it starts, and it usually gets to us at that point. And that's kind of how we're handling that. Ray, do you want to add anything else as far as what we're dealing with on the compliance end?
Do you want to just, for anybody who's listening, explain how the fines can work? It is a $300, up to a $300, $500?
If you're using the governor's orders and his fining structure outlined in the order, which is what I'm doing, I am fining at $300 per violation of the governor's orders, which it's spelled right out on where your violation is there. So that's what I'm attaching.
Per violation, is that just the whole event, or is it per person beyond the limit?
So it is my understanding that a gatherings order I could fine per person, but that also means I need to write a ticket for every single person that violated that order. That may prove difficult to do if you can't identify every person, and that might be a little challenging. The person that is hosting the gathering and not controlling it and not requiring masks is the way I have elected to enforce this. So I am trying to stop it at the source as opposed to stopping the person that went to the gathering.
Okay, thank you, Jeff. So just a reminder to people, gatherings need to be under 10 people or fewer, and you need to wear masks.
I would even go so far to say as if you don't need to gather, don't even do it. We can clearly see that there's transmission occurring at the home level. We're seeing it with the families, as we discussed earlier tonight. If you don't need to, consider not doing it. There's always going to be a case where a family member needs to be with another family member for whatever their reason is. But if it's friends going to hang out for a fun night, consider not doing it or find other alternatives to do so safely until we can get through the surge.
And hopefully that won't be too much longer. I think the light is at the end of the tunnel. We can see it.
Can I just say one thing about that? You say, please take steps now. At the end, you say get tested. So this is a bone of contention, right? Where do we get tested? So I think I talked to you at one point, Jeff, about, aren't they going to try to have something for us in the, Merrimack Valley? Was there some discussion?
So I reached out to the state regarding a Stop the Spread site in the upper Merrimack Valley area because there is nothing.
Yeah.
And I really think that if we push a little harder, maybe we'll get a shot at having one between Tingsboro, Tewksbury, Lowell, Chelmsford, Westford, Dracut, Billerica. There's a lot of people that are in that neighborhood, and there isn't an easy option at the current time, other than what some of the hospitals and urgent care centers are doing. So we'll continue to try to look for an option for that.
Well, I had a teacher today who, she was identified as a close contact, and yet she had to do a telehealth with her doctor, and then her doctor said she didn't have symptoms, so he wasn't going to authorize a test. It's like,
So
oh my God.
People can still go to the Stop the Spread sites, and I know people who have been going to Marlboro and Lawrence from Westford and being able to get their testing taken care of there. So those are options.
Yeah.
Well,
There's
the Lawrence, it's very difficult getting through some of those Stop the Spread sites. They wait hours and hours and hours, and some they have to close. I mean, because having run a number of them. You can't have 200 cars in line at 2 o'clock when you're slated to close, so you have to close early. Just to tack on to what Jeff said, I appreciate his help, because obviously, you all know I'm in Lowell. We've done multiple reaches out to the command center and to a variety of other people. The issue is that this section of the Commonwealth is sort of covered, if you will, if you look at the region, because there's a site in Lawrence and a site in Methuen, and they're looking to make sure that there's stuff in every region. But we're trying to address it more as the Greater Lowell area, because, like Jeff had said, the Westford, Lowell, Tingsboro, Drake, this whole part of the Merrimack Valley is not covered at all. So we're trying, and I know that also Sue Rosa tacked on to Jeff's email the other day after I spoke to him, and sent it up to Janet Ferguson, who's one of the assistant commissioners. So I appreciate that help. And I think if we all band together, maybe we can bring something into the this area. It's not for lack of trying, for sure. I know that the Stop the Spread sites are stopping. Again, when we were talking about the CARES money and all that kind of stuff, all of that's gone. So there's this little interlude when we don't need it after the holidays, as we go into the next year, and we'll have to wait to see what the funding is like and what the state is going to decide to do, and what they, their funding allows them to do next. They have set up the Project Beacon sites, which are really sites that it's more like a consolidation of the Stop the Spreads. So there's one in Framingham, and there'll be one in Lynn. It's the same thing. Project Beacon runs really, really well. It's all by appointment. We've had multiple talks with them, so I know how their system works. They're very efficient. They track their appointment times and their throughput times, and because it's appointment driven, it's people are in and out. So if you can get into any of those sites, those like the Stop the Spreads are for the Commonwealth. So I would suggest going to the Framingham site, but it's a problem. It's going to continue to be a problem until we get through this. So
and nobody should be paying. I think that's one thing that we've seen too, right, Gail? That some of the Carewell or different sites, and they're charging people $160. So then people will say, well, so there's a misunderstanding sometimes too that you can get a free test. And I always try to say to people, you should not have to pay when you have symptoms, or when we're telling you to get tested. You should not have to pay.
Right. So if you, there is that letter that you can send. Sure, you do it. So that they have proof when they go in that they have been identified as a contact to a case, and they can be tested, and goes through their insurance. People do test for other reasons. They test because, they're concerned, or they test because they need to travel and all of that. That is definitely out of pocket. But you
know what, Joanne, one of the things that happens is, and right, Gail, before they go get tested as soon as they know they're a close contact, before we can even get them a letter, because,
Right. Yeah. This is true. It is concerning.
They panic and they want, they find out they're a close contact. They rush to get tested. They pay $160 or, oh my God.
Yep. Yeah. My concern is the information like that you just relayed, coming from a physician that says, I'm not going to test you.
Yes.
I've heard about, this rhetoric from back in the spring where, oh, it's in your household, we're just going to assume you're positive too because you have a cough. It's a little disconcerting, some of the information that I'm hearing providers, both pediatric and adult, right now, because testing is out there. Back in the spring, none of these sites existed. At least they're out there now, and you can go to Circle Health, and you can go to, CVS's and the Walgreens. That's really concerning to me, because we want people to get tested and find out, because we're in flu season, right? well, if it's not COVID, it's got to be something, and treat them for flu or strep or whatever. Don't just kind of wing it off. So it's interesting to hear that you are hearing the same thing we are, and I think that's concerning. And people, if anybody's still listening, I don't know if I can't see who's still on here. Speak up and tell your physician, I've been, I'm not feeling well, or I want to get tested. I'm hearing a lot of pushback from the provider community. So
It's a shame.
anyway, that was my little soapbox. Thank you. We need all the help we can get. I mean, even if the board wanted to, put together a letter, I may have to not sign it, but I mean, just to kind of advocate for testing in the greater Lowell area. I think that's a better way to put it, because they'll tell you that it's okay in the Merrimack Valley because there's 2 sites in Lawrence and Methuen. Like, that's great. They're right next door to each other and nowhere near us. So,
Thanks, Joanne. So Jeff, was there anything more? You have both the 6:45 to discuss protocols and then new business to talk about the vaccination guidance. Are we on to new business?
Yeah, and really that was something we wanted to bring up in the office. There's a lot of people asking, and staff is getting asked by other departments. Ray's been asked by the police. I've been asked by the water department. When are we going to get the vaccine and when can we have it? And the bottom line is right now, we don't know yet. We don't have it. We're not sure what local public health's role is going to be in any vaccination process. Based off of what the Pfizer vaccine is, we currently don't have the capacity to even store it at -90. And we don't know how much we would actually get yet. As far as some of those questions, I've actually asked the Office of Preparedness and Emergency Management, and I was told that information will be taken back to their working group on how that's going to be presented. And I think Joanne knows as well as I do. We just don't know yet. And when we know, we'll share. And if you see the UPS guy going into our office with a box, it's not the COVID vaccine. We can promise you that.
yeah, I think the only thing we've really been told so far is we're probably in phase 3 or 4 for mass vaccination clinics. We get the Moderna product, which was regular vaccine storage and refrigerator storage. So they came out with the protocols on who they want to do get immunized first, but the hospitals and health centers are getting them this week or next week. It's coming. It'll be in the Merrimack Valley. It'll be in the greater Lowell area this week and next week. It's going to be here. It's very, very soon.
Thank you.
But for the first priorities.
Jeff, I can't see below new business under correspondence.
I think that was all I had because I knew this was going to be a fairly busy meeting.
All right. Well, then I guess we are looking for a motion to adjourn.
I'll make that motion.
Oh, I've got a question. Hang on. I've got a question. Hang on.
Okay.
Question.
Let's see. As a healthcare provider, I did want to comment on the local offices are overwhelmed and may have 3-day wait for a test appointment. The Stop the Spread sites are very difficult to get an appointment, and walk-up drive to sale sites that have 3-hour waits an hour before opening. It's very difficult for those to need to get tests done. So it's more of a comment, and thank you for the comment.
Yeah, we agree. It's terrible.
And wear your masks when you have to go out.
Right. So I'm not to make this go back and forth, but that is very, very true. All of what was said. That doesn't mean that you don't give a patient an order to go get a test. That if they might be able to get one in a day or two, as long as they have an order.
Thank
Give
you.
them the order.
Okay. All right. So I think Michelle had made a motion to adjourn. Do we have a second?
Second, Beecham.
Joanne, second.
I unmuted early.
All in favor?
I,
Motion passes unanimously, I think, Zach. So thank you, everyone, and we'll work on the tobacco stuff and stay well and healthy and meet next month.
Merry Christmas.